Good evening. Thank you so much for joining us this lovely Thursday. We are live on Family TV, also live on Family Radio. The show is called This is the Day, and my name is Medrin Nyambura. So on Thursday, we look at a couple of things in regards to lifestyle and your health and how to make it better. So this is only because I have gone through it. You probably have, or you know someone who has, and also requests came for us to do this show. We are talking about acne and how to get rid of it. Everybody wants to look as good as the magazine models, but the reality is we all can't. So today we're going to be learning on what we can do about acne if you're suffering from it or if you know somebody who is. In studio we have Angelina Macido. She's a clinical officer at Special Treatment Center. Karibu sana.
Thank you.
And you were telling me that one of the greatest challenges or the largest number of patients you have are those who have issues with their skin.
Definitely.
Explain that for us, please.
Okay. Most of the patients who seek services from our facility, they have skin condition, mostly eczema and acne. But today we're going to talk about acne.
Yeah.
Because that is what has brought us here.
Yeah.
So acne, this is a disorder that usually affects the skin, and it is characterized by dilated hair follicles, which is filled with keratin, sebum, that is oil, and bacteria that results in inflammation. So mostly symptoms occur on the face, the upper chest, and the upper back. Yeah. Mostly we find it in teenage, during puberty, and the condition usually subsides by the time they reach mid-20s. Yeah.
Okay. But we know of people who got acne when they were teenagers in high school, and then they recovered. Then you know those who got nothing. Then they hit 25 and it all went downhill. Why does that happen?
When they were young, they did not have.
They were okay, yeah.
Then when
they
they
get to their mid-20s and they get it.
Above,
yeah.
We usually have what we call drug-induced acne. And this one can be as a result of using topical agents that have steroids. And that is what usually happens with the majority of women. Anything that will lighten your skin, whatever you use that will lighten your skin, probably most likely it has hydroquinone and steroid. And prolonged use of that will give you what you call drug-induced acne. And when you reach the age of 30 and you happen to have drug-induced acne, I'm telling you, managing it is a problem. Yeah, so majority of women, they are using products that have steroids and hydroquinone, especially this mkorogo thing that women get along River Road. Products like, they call it Carolite, I don't know, Cocodam. Yeah. You apply, you look beautiful, but after some time, you'll have to look for a skin specialist. Yeah.
But then what happens for people, maybe they didn't bleach their skin, it's just that it happened. They just happened to get it much later in their lives.
Probably the products that they have, they are using on their face. And then, if I may go to classification, I'll classify like, one, I say that it occurs during puberty. It can also be hormonal. There are some contraceptives that have progestin in it. It will trigger or worsen acne. Then, as what I've said, drug-induced. Then there's also genetic predisposition. And this occurs to people who have oily skin. Oily skin.
Yeah.
So oily skin is that kind of skin. After you have showered, you don't need to apply anything, but it keeps on shining. So that we call it an oily skin. So people with oily skin are predisposed to getting acne. And they seek services. We put them on treatment. They get well, but after some time, they go back to square one, where we started. And that is all because of the genetic predisposition. So even when you take history, you'll find that even my mother used to have it, my sibling has it, some members of the family have that acne and have a tendency to have an oily skin.
Okay.
Yeah.
So let me ask this question. I have had this even told to me personally, where people will tell me, "Don't worry, when you get a child, it's all going to go away." What's the correlation between carrying a baby and getting the child, and you and your acne disappearing?
That is what I'm saying all about hormonal.
Okay.
You know, the moment you get pregnant, the hormonal changes that occur in the body. Yeah. Yeah. And also, hormonal can also be, I might say, emotional health or stress related. Because once an individual is stressed, the body releases a stress hormone, what we call cortisols. So there are these cells that produce sebum. They have receptors for the stress hormone.
Okay.
So when you are stressed and your body releases the stress hormone, chances are your acne may worsen.
Okay.
Yeah.
Okay. I hear you. You've talked about hormonal, but let's talk about the environment. People who live in very hot areas we tend to have very clear skin. Yeah, like Mombasa, Kisumu, that one may favor the skin a bit. If you come to this or Nairobi or you head down to the mountains, your skin then starts to, have the acne. Any correlation?
There is no correlation between environment and acne. Probably they have some other skin condition that may look like acne, but there is no correlation between acne and the environment.
Okay.
Or even acne and food.
None at all?
None. We cannot. There is nothing that has been documented. Yeah, even in the medical books, that we can say there is some association between food and acne or environment and acne.
Okay. But what happens to people when they eat, they eat fries and fatty foods, then it shows in their skin?
There has been nothing to document. Nothing has been documented to prove that. I think it's a belief. It's a myth. Haven't you seen obese people with very smooth skin?
Okay.
Yes.
Sawa sawa. But can you correlate acne to food allergies?
Okay. There are some situations that some people develop allergies, food allergies. They develop eruptions on their skin, and then they go to the chemist. They get over-the-counter prescriptions without having to pass through a doctor or a clinic officer. Then they are prescribed for medications that contain steroid.
Okay.
They apply, they get better. So when they see their skin that has improved, they continue using the product. So in the end, they end up getting drug-induced
acne. Okay.
So they say it started like a rash, but you see with the prolonged use, they end up getting what?
The acne.
The acne, definitely.
Okay, I hear you. So, you're saying there's the drug-induced acne, and you also have the acne that will come, you say, as a result of not food, not environment, but it may come when you're older, about 25. So how do you know you have any other skin-related condition and it's not acne?
That one I really recommend that one visits a health facility and you are seen by a qualified person, because skin condition like folliculitis, infection in the hair follicle, might be confused with acne.
Okay.
So you might be having folliculitis and you think that you're having acne.
Okay.
Yeah.
What's the word you said again?
Folliculitis.
What's that?
Infection of the hair follicle.
Okay.
Yeah.
In what context does that happen?
Also, okay, it's just a bacterial infection. It can happen if you had an open skin. Yeah, it can happen when you had an open skin. If it becomes bigger, it translates to a boil.
Ah,
Yeah.
okay. Okay, no, yeah, I get what you're saying. Sawa. Also, can you talk about makeup as well? Not the steroid makeup or anything, like proper makeup that you use on your face. Any relation between that and acne?
Definitely, there is. Most of the people use makeups, but do you know the contents of that makeup? People don't know. You might read the contents, but you don't know whether they are harmful or They are not harmful.
Okay.
Actually, we usually tell people, if you have an oily skin, don't apply anything on your face. Just wash your face and stay like that and hydrate it. What your skin needs is hydration. So you have an oily skin and you're applying more oil on your face. What will happen? You're making it more oily.
Okay.
And you have said that people with oily skin are the one who are predisposed to getting what?
The acne. Okay.
So I understand that there are products that they are oil-based and others are?
Matte. The one that prevents the oil.
Okay.
Yeah.
So you could be having an oily skin and also you are using an oil-based product.
Oh, you mean the product, so oily-based and alcohol-based?
Something, or water-based.
Or water-based, yes.
So it will also worsen. So sometimes you might use a makeup and you see you get some skin reaction. You need to ask yourself whether you are using the right product on your skin.
Okay.
Yeah.
But I'm thinking for the people who have an oily skin, so I have an oily skin, my job requires me to put a few things here and there.
Makeup.
Yes. What happens if you can't escape it? Because you said, for oily people, your skin can actually do without it. But what happens if you can't do without it?
Now, I'll just what I can advise is that you need to clean your skin frequently.
Okay.
Yeah, because even when you wash your skin, even with warm water, you're also removing excess oil.
Okay.
If you are somebody who's using makeup, then you need to find or devise a way of removing the excess makeup. Because even sleeping, going to bed with makeups, you are clogging the pores.
Okay.
And we have talked about having. If you have an oily skin, you have a dilated
follicle? Is that what you say?
Yeah, your hair follicle is dilated, yeah?
Yeah.
Yes.
Okay.
So it will be filled with keratin, that is the dead skin, bacteria, and the sebum.
Okay.
Yeah.
Sawa. If you have any questions, do send them over to 0316 0786 316 316. And today we're talking about acne. I'm seeing a couple of questions. I will get to them in a few. But then let me ask you, Angelina. We've talked about makeup, and you said, the idea of going to bed with makeup is not really advisable. Actually, sometimes you're tired, but yes, it's not advisable. I can see you giving me the eye. Can I use wet wipes to just remove the makeup? Is that okay?
Okay. What is the composition of the wipes?
Now, Angelina, let's be realistic. When I'm going to buy wipes, I look for the ones that have a baby, because they say if it's good for baby, it's good for you, right? So I pick the softest ones that I know.
I prefer soap and water.
Okay.
Yeah.
And the cleansers that makeup lines have?
Okay, cleansers are good. Cleansers are good, but how many can afford?
Okay.
How many can afford? Yeah.
So sabuni maji.
Sabuni maji.
Okay, sawa. Let's get to a couple of questions. Sylvia, you tuned in from Westlands. Thank you so much for hanging. You're saying, my skin breaks out seasonally and I do not use makeup. I just apply a little olive oil on my face every day. I don't use contraceptives or strong bathing soaps or products, but I get an occasional breakout. I suspect it's something to do with my cycle. Is this possible, and how can I keep the acne from showing up? Please answer her.
Exactly. She said seasonally. Yeah.
Yeah.
Yeah. That one, I will also classify it under hormonal. There are some women, a few weeks or during their menses, they tend to get acne, which disappears after the menses. Yeah. So that one that is hormonal, that is related to the menses, it usually disappears spontaneously.
Okay.
Yeah, and it's not a cause of alarm.
Okay, so that one should not worry you at all?
Yeah, should not worry.
What if it's only focused on your forehead? It only comes to your forehead. Should you be worried about that?
Seasonally.
Yeah.
As long as it disappears spontaneously, yeah, it's not a cause of alarm.
Okay.
Yeah.
Also, a gentleman asking, this is a good one, when he shaves, he gets a lot of acne around the area. Yeah. What leads to that?
That one, I will not call it acne.
Okay. What do you call it?
Probably acnetoid keloid, probably. Or another thing, most likely it could be having also infection on the hair follicles. In such a scenario, I will advise the gentleman to seek help in one of the health facilities.
Okay.
Yeah, he has to be examined so that the clinician or the doctor who's there will determine whether this is acne. Is it acnetoid keloid or is it a infection of the hair follicle?
Okay.
Yeah.
So, somebody else also asking, hi Jed, you're asking, can juicing help reduce acne?
Sorry, can
juicing help reduce acne? You know how we're doing the healthy juices, you do your skuma wiki, you do your spinach and your fruits and your seeds. Can that reduce acne?
what have we said? There is no study that actually we can quote or has been documented, or if it is there, it is very limited, that we can relate. We can say there's some association or correlation between food and acne. But what we usually tell people, water reduces breakouts.
Okay.
Fruits, vegetables in the class of vitamins, they help us in fighting diseases.
Okay.
Yeah.
So I'll ask this question. Let me follow up with this one. So you've mentioned foods that doctors will say you eat a lot. You have fruits, you've mentioned vegetables, the greeny leaves and all that. If you have food that will make your skin better, surely don't you have food that will make your skin worse? Now let's talk layman language. Acha tuweke medicine kidogo tu. If you have fruits, vegetables, and the skuma wikis and the spinach that will make your skin better, don't you have food that will trigger acne or make it worse?
It could be there, but actually what I'm saying now, there's nothing that has been documented actually that I can quote, even from the medical books that I've been reading. We cannot classify acne as food-related.
Okay.
No.
Sawa.
Yes.
Okay. Another thing is, and this one I've seen with people who've decided to juice and the skin clears and everything, and the juicing will get rid of toxins, yes, in your body. Is it safe to say that? Juicing, when you take the healthy juices with the skuma wiki and everything, it gets rid of the toxins. Right? Are the toxins related to acne? Not the food, the toxins in your body. Is that related to acne?
Okay. When you have accumulation of toxins in the body, accumulation of toxins can be related to when you have kidney failure, because the function of the kidney is to purify blood.
Okay.
So actually, if your blood is not purified, you will have some skin manifestation.
Okay.
And actually, we may not classify it as acne. You'll have some other skin condition, but not acne.
Okay,
Yes.
sawa. Somebody else asking, hi family, please help me. I'm having issues with dark circles under my eyes. I get enough sleep and eat well. What do I do? Please.
Dark circles under the eye. Okay. That one also we need to examine, because actually, as I've said, some people use products, and you know the skin near the eye is thinner. It's not as thick as this one. So you see people who use also steroids and products that have hydroquinone, after exposure to sunlight, they tend to have the skin around the eye darkening.
Okay.
So I'll advise, is it a gentleman or it's a she?
It's a lady.
Yeah, I'll advise her. She can seek help in one of the health facilities, or also so she can come to our facility.
Okay.
Yeah, we have to get a look at that.
Okay.
Yeah.
But do I need to be worried if I have dark circles around my eyes?
Okay, if you don't have a diagnosis,
Yeah.
Yeah, you need to have a diagnosis what it is actually.
Do you have dark circles? I'll ask you that question. Do you have them around your eyes?
Yeah, I don't have them.
Okay. Okay. Sawa. Let me see this. Okay, they're still typing. It's fine. Also, let's talk about what you need to do to actually treat the acne. So maybe you can walk us through the treatment process and what you need to do.
Okay. Majority of acne, for those who are in puberty, will clear spontaneously
Okay.
by the time they reach mid-20s. So we have mild acne, that can be treated by use of topical agents. You get a prescription from a clinic officer, from a doctor. Then we have moderate acne that we use also the topical agents and also oral antibiotics. Then also we have a severe form of acne that is associated with scarring. It leaves very ugly or big scars on the face.
Yeah.
That one also might require a specialist treatment. And the duration of treatment could be 3 to 6 months. And sometimes the severe form, in my practice, I have associated with immunosuppression, HIV.
Okay.
So when your immunity goes down, your body cannot fight these infections. Yeah.
Okay.
So I usually advise people, because I've seen most ladies especially, they get acne, then they get advice from social media. Or you see what your friend has been using, then you borrow their prescription and use the same medicine. But they need to know some of these medicines that we use to treat acne cannot be used by a woman who's pregnant,
Okay.
or a woman who's breastfeeding, or a lady who's planning to get pregnant probably in the next 6 months.
Okay.
Yeah, they will have adverse effects on the fetus or even on the breastfeeding child. So anyone with acne, please seek advice from a health provider.
Okay.
Yeah.
So getting advice from social media, I have done that. Let me explain. I had a really bad breakout. And at the time, I was quite worried because I thought I need to do my job and I look like literally Nairobi flies all over my face. So I posted it on Instagram. And this lady did not give me medicine, but the old age things that work. So you have rose water, you have that should, dry out the oil. You have olive oil for this. You have... So I also don't advocate for taking those social media tips, but don't you have the old school things that will work to date? Do you have those?
Yeah, yeah, I think they're there.
Okay.
I think they're there.
Can you mention some of them?
Okay, like we used to believe that when you take a lot of water, actually it reduces skin breakouts, and it is true.
Okay.
That one happens. I remember when I was in high school, I used to see ladies apply lemon and honey, and then they steam their faces. Somehow it worked.
Okay.
Yeah.
Okay. Sawa. Let's listen to... Okay, sorry?
Yeah, I also wanted to say that they can also seek, not when you have acne, if probably you have you are looking for a product for your skin,
Yes.
It's good also you seek help from these people who have done beauty therapy.
So before you even buy it?
Yeah, they understand your skin, they understand about the beauty thing, other than just doing things haphazardly.
Okay, sawa. Sorry to cut you off. Thank you so much for staying with us for the show. And there's one question that has come through. Luckily, we had it as well. What is the best skin routine to make sure you don't get acne?
When you're talking about best routine skincare, it's not that we are applying this routine care to prevent acne, because I've told you, if it is drug-induced, there is no routine care that will prevent it, because it is drug-induced. But basically, we are talking about normal skincare for anyone. And what I can say, the best people who can give you this advice are the beauty therapists, those who have done probably diploma or certificate in beauty. They are the best who can advise you on these products or on the routine skincare. But what I can say, old is gold. Yeah, our mothers, our grandfathers, they used to use soap and water and a small towel. You just clean your face, that's all.
Okay.
Yeah.
And that works. Okay.
Yeah. How many people will afford going to the beauty therapy. Not many.
Okay.
Yeah.
Sawa. And also in the same question for routine, cold or hot water, what works best?
I will say warm.
Okay.
I'll say warm water.
Okay. Sawa. What happens with people who never get acne on their face at all?
Now that I said it's all about genetic predisposition.
Okay.
There are people who naturally, they have what people call them baby face. The others who have oily skin. It's all about genetic predisposition.
Yeah.
Yeah, if you have a baby face and I have an oily skin, there's no way my skin can be like yours.
Okay.
Yeah, it's all about genetic predisposition. Yeah? And so
Okay.
that is something that people need to understand. Yeah.
So give us the final word on acne and how to go about it.
Okay, what I usually say is that after acne, majority of people develop dark spots, and this is what leads them to go looking for a product that will remove the dark spot.
Okay.
And any product that you're told that will remove the black spot will definitely lighten your skin. So actually, we do not offer treatment for the dark spot, because that actually is usually a post-inflammatory color change.
Okay.
And it will disappear with time, because the skin usually sheds itself with time. As long as you do not have a further or more occurrence of acne, the skin will shed itself slowly, and the dark spots will disappear with time.
Okay.
So no need to go looking for products to remove the dark spots. You'll end up damaging your skin.
Okay.
And then something that I will also advise the public, please stop going for over-the-counter prescriptions.
Okay.
Especially when you have a skin issue. Please seek for help from a qualified medical practitioner.
Sawa.
Yeah. Either a clinic officer or a doctor.
Okay.
Yeah.
Sawa. Thank you so much, Angelina, for coming through. Thank you. Angelina Macedo, from a clinical officer from a special treatment center. And if you've got any more questions, you can send them over and we can always address them off air. But from us, thank you for watching. See you tomorrow.